Hi, my name is Peyton Halbrook, and today I'm going to be talking about the rise of telehealth and its impact on pharmaceutical sales. So basically, the vision, imagine trying to sell a product to a doctor who no longer sees sales reps in person. It's a very different type of way that people are looking into now, just because for the longest time we didn't have technology that was able to get us there, but telehealth is reshaping pharmaceutical sales and how reps connect with healthcare providers. Especially ever since COVID-19, that pandemic, patients and providers interact has changed significantly. And basically everything about this project, what I'm going to be talking about, is the rise of telehealth and how it significantly impacted pharmaceutical sales by reducing physician access, shifting communication strategies, and increasing the use of digital tools and data to help them better their program. So why does this matter? First off, credibility. Everyone needs it in this world. And communications, students focus on pharmaceutical sales, so anyone that's in that field or anyone looking to go into that field, and anyone that's researched current trends in telehealth and the pharmaceutical world. It does have relevance, and the audience should listen because pharmaceutical salespeople must comprehend these developments to succeed in the constantly evolving healthcare environment. And then after that, as someone that's interested myself in the pharmaceutical field, and I feel connected with the professionals within it. My dad is, or was for like about 20 to 25 years, a pharmaceutical rep. I witnessed firsthand how telehealth innovations have been reshaping the industry, especially ever since COVID in the last few years. How technology has been able to help their field and everything within that. So today, again, the three main points that we're going to be going over are the reduced access to physicians. So with the rise of telehealth, pharmaceutical reps have fewer opportunities for in-person meetings with doctors, limiting traditional sales interaction. Not that it's completely gone, but sometimes it can become a struggle when there is a lot of doctors that won't take people in person anymore. The next thing is shift in communication strategies. So some reps now rely on virtual representations, emails, and video calls to communicate effectively with healthcare providers. And then lastly, one of the biggest things actually, use of digital tools and data analytics. So advanced digital platforms and analytics help reps personalize outreach, track engagement, and tailor their sales approach to individual providers. So the first thing I really want to look into is exploring how telehealth has changed the traditional access pharmaceutical reps have to physicians. So the first point, rise in remote healthcare. Telehealth has rapidly expanded, especially following the COVID-19 pandemic. Many doctors now offer virtual appointments instead of traditional in-person visits. I can actually remember during COVID and the time that everyone was supposed to be at home, we were able to get online with the doctor and submit test results in our car. And then we had a doctor's appointment at home over Zoom. So things have really came a long way in the past few years. And the shift is more flexible also for care with patients and limits access for external visitors like pharmaceutical reps. And as a result, in-office time is often prioritized strictly for medical staff and patient needs. So there is a lot of changes, and the decrease in person meetings for sales reps has changed a lot. So with more providers working remotely on or reduced in-office schedules, sales reps have fewer face-to-face opportunities. Offices are limiting external visitors to disruptions, and they're maintaining patient safety, which is of course reasonable. This change means that the traditional drop-in visits are no longer effective or even permitted in some of the clinics. Reps must now plan outreach more strategically and seek digital alternatives to maintain relationships. With that being said, since there is shorter interaction times with providers, they have to find a way to still build that relationship and try to sell their drug basically to these doctors. The doctors' schedules have become tighter, especially with the increased demand for virtual consultations. Even when reps do get meetings, the time available is often very limited. So sales pitches must be concise and focused and value-driven to get the effective meaning that they need in the short time period that they have. The demands that are stronger that need stronger preparation, and messaging skills from reps need to be practiced before the interaction, just because you don't have the in-person part to rely on. You have to be able to work with it over a screen, which can be hard, but it can be learned. So getting in the practice that's needed is always helpful. And that leads us to the shift to remote or hybrid sales models. Many pharmaceutical companies have embraced remote or hybrid sales teams to adopt the reduced in-person access. Reps are now expected to use video calls, emails, and digital presentations as primary outreach tools, or at least know how to use them. Hybrid models allow for occasional in-person visits when possible, but digital engagement is now the norm for some people, obviously. There is still a lot that can go into the doctor's offices, but for the people that are learning to do it hybrid, it's very important to learn these new systems. This new model requires reps to be tech-savvy and comfortable with virtual communication platforms. And now I wanted to talk about pharmaceutical sales teams that have been forced to reconsider their communication and engagement strategies due to the decreased availability of physicians. So, new communication strategies. In line with that, virtual presentations are replacing in-person pitches. So, with fewer face-to-face meetings, virtual presentations have become the new standard in pharmaceutical sales. In line with what a company says, their company name is IQVIA. They have came out and said that pharmaceutical companies now use virtual meetings, webinars, and email campaigns to reach healthcare providers, which makes perfect sense with the digital world that we live in. They use also platforms like Zoom, Microsoft Teams to present drug information and product updates. These presentations must be visually engaging and well organized to hold the attention of busy providers. While the format is different, the goal remains the same: clearly communicate value and build trust with each other. Another new communication strategy is the importance of strong digital communication skills. So reps must now be skilled in written and verbal digital communication to succeed in their virtual environments. So the ability to craft clear, concise emails and speak confidently on video calls is more important than ever. Digital communication lacks body language, cues, so tone and clarity and professionalism must be clearly managed. Mastering these skills allows reps to maintain strong relationships even without the in-person interaction. A great way to maintain these strong relationships is by follow-ups through email, video calls, and secure messaging. So after virtual presentations or introductions, follow-up communication is key to building ongoing relationships. Reps commonly use email, video check-ins, or secure messaging platforms. These follow-ups allow for answering questions, reinforcing key points, and providing additional resources. Consistent, respectful digital follow-up help us establish and keep the provider engaged over time. It basically is the key to building these relationships and keeping them going on to be able to build them and become more powerful. As well as the new communication strategies, technology actually itself offers powerful tools to improve publicity in this Salesforce environment. So digital tools and analytics, the CRM platform used to track and tailor outreach. So leveraging these CRM platforms and data to tailor this, according to Imprivado, data analytics help identify prescribing patterns and target relevant physicians with customized messaging. It measures engagement across audiences to be able to identify key healthcare professionals for the most targeted outreach. So this is great for the workers. They're able to keep track of the interactions, preferences, and communication history. It can be customizable, their approach based on specific interests and the needs of the doctor. So every relationship is different. One doctor might need something else, and it helps you keep track of everything so you don't lose it by the next appointment that you have. This makes outreach more efficient, focused, and likely to lead to productive engagement, which is ultimately what every salesperson needs with their clients. As well as personalized digital marketing content. So pharmaceutical companies are now creating tailored digital content that speaks directly to providers' specialty or interests. These include targeted emails, videos, infographics, and product updates relevant to the doctor's patient population, which is basically everything that has to do with selling these drugs. They need to hear the same thing over and over again, so that way they realize when a patient that they have is undergoing some sickness that works with your medicine that you're selling, they're able to remember, like, I got maybe 10 different infographics about this specific drug. I think this would work for my patient, and they're able to use that. Personalized content builds stronger connections and shows that the rep understands the provider's unique challenges. When reps send information, it's directly useful. Doctors are more likely to engage and respond positively. What's also really cool about the CRM platforms is it gives real-time engagement and data-driven follow-ups. So this real-time data gives insight into what content doctors find most useful or interesting, which is basically what you need to be giving to them, because that's what's going to want to make them buy the drug that you're trying to sell. Reps can then follow up at the right time with the right information instead of using a generic approach. These data-driven follow-ups lead to more meaningful conversations and better relationships that build over time. So, in conclusion, telehealth is a permanent part of healthcare, and the future of pharmaceutical sales representatives will be better equipped to establish stronger bonds and thrive in a changing healthcare environment by embracing digital innovation. The growth of telehealth has significantly impacted the way that everything is sold, and we've looked at how reduced physician access challenges traditional sales methods, how communication strategies are shifting to virtual platforms, and how the digital tools and data analytics empower more precise outreach. Clearly, telehealth is reshaping pharmaceutical sales, and its required adaptability and innovation approaches are set up to succeed. Thank you.